The metabolic troubles of periparturient dairy cattle. Topic 3, hypocalcemia. So subclinical is more common. Clinical is milk fever and parturient paresis. It usually occurs within the first 72 hours post-calving. Cows will secrete 20 to 30 grams of calcium into colostrum and milk in the early stages. Decreased serum calcium of a cow from 8.5 to 10 milligrams per deciliter to 7.5 milligrams per deciliter. The causes. So the alkaline daily ration within the cow has a high cation-anion balance in the last 2 to 3 weeks before lactation. The high cation-anion balance caused by high calcium or high potassium. The cation-anion balance formula is sodium and potassium minus chloride and sulfate in EQ per kg dry matter. High cation-anion balance value inhibits PTH function. The role of PTH, it increases calcium mobilization from the bone, it increases calcium reabsorption from the kidney, it increases vitamin D production in the kidney, and it increases calcium absorption from the GI tract. The consequences: hypocalcemia, milk fever due to increased calcium demands and increased cation-anion balance value. The ataxia, hypersensitivity, twitching and tremors on the flanks and triceps, recombrancy, decreased muscle contractility, which leads to paralysis, and GI stasis, bloat. Coma in severe cases. Milk fever risk increases with age. The second and third lactation require more milk, therefore more calcium, but in animals less capable of mobilizing bone and calcium, transporting in the intestines and producing active vitamin D. Jersey cattle are more prone to milk fever. Their small size but high milk yield is that which has high protein, fats, and calcium. Fewer vitamin D receptors to absorb the calcium due to their small size. And prevention. Preventing a high cation-anion balance value via diet for the last 2 to 3 weeks prior to calving. The optimal cation-anion balance, this is minus 50 to minus 150 m EQ per kg dry matter. Give ammonium chloride or NH4Cl supplement in the feed to acidify the ration. This decreases the cation-anion balance value. And note, this will cause slight acidosis for the first few weeks. The urine will be 6 to 6.5 pH and decrease potassium intake prior to calving, as it increases the risk of milk fever. High potassium inhibits magnesium uptake. The PTH requires magnesium, and a low potassium diet prior to calving is needed, so avoid alfalfa. The vitamin D injection. This enhances calcium absorption from the GI tract. The injection 8 days before calving, and repeat if the cow doesn't calf on the due date. The synthetic bovine PTH enhances calcium absorption and stimulates bone reabsorption. And decrease the calcium prior to calving because it may help activate the PTH